Vitamin D isn't the problem, but taking it the wrong way can quietly damage your heart, kidneys, and blood vessels. And the scariest part, so many people are doing this to themselves every single day just by taking vitamin D3 magnesium and K2 consistently for years without ever checking their levels, without adjusting, and without any warning. A lot of people genuinely believe they're protecting their bones, boosting immunity, and living healthier. But in medicine, not every nutrient should be taken continuously, without breaks and without oversight. Supplements aren't candy, and the longer the better is one of the most dangerous misconceptions I see all the time in my middle-aged and older patients. Today, I'm going to help you understand when it's safe to take them long-term, when you need to adjust, and how to make the D3K2 magnesium trio truly safe for your body. If you care about your health, make sure to subscribe to the channel and hit the notification bell. But before we dive in, let's first understand the right way to approach supplement cycling. Over more than 30 years of working with patients over 50, I've realized a very simple truth that's often overlooked. The human body wasn't designed to take something consistently forever. Whether it's medication or supplements, if you use them continuously at high doses without breaks, sooner or later, your body will speak up. In modern nutrition, we call this principle supplement cycling. It might sound academic, but at its core, it's incredibly practical. It means taking nutrients according to your body's natural rhythm, not just out of habit. Sometimes your body needs more, sometimes less, and sometimes it just needs a rest. When you follow a pulsing approach, your body avoids tolerance and dependence, where self-regulating systems become lazy. Your liver and kidneys, two hard-working organs quietly running day and night, also get a break with time to process and recover. I've seen countless people improve their health simply by stopping the mechanical routine and starting to listen to their bodies. Supplements should be smart helpers, not something you blindly take every single day. And that, my friends, is the foundation for sustainable health after 50. Once you understand that the body needs cycles and shouldn't just take supplements blindly every day. The next question is, which nutrient needs the most careful regulation? Among all the popular supplements out there, there's one that many people take, but completely misunderstand, and that's vitamin D3. Vitamin D3 isn't just a simple vitamin. Biologically, it behaves more like a hormone than a typical vitamin, and that completely changes how we should use it. Unlike vitamin C or B vitamins, which are water-soluble and excreted fairly quickly, vitamin D3 is fat-soluble and stored in body fat. That means a dose you take today can remain in your body for weeks, even months. I've seen patients taking 5,000, even 10,000 IU daily for months without ever checking their blood levels. And honestly, it worries me. Not because D3 is bad, but because it's being used incorrectly. When vitamin D3 accumulates, too much calcium levels in the blood can rise. And the consequences don't appear overnight, they come quietly, as prolonged fatigue, irregular heartbeat, unusual thirst, or subtle imbalances that most people would never suspect are caused by a vitamin. Using it wisely isn't complicated. If you live in a sunny area and get 15 to 30 minutes of sunlight daily, your body is already producing some D3 naturally. In that case, reducing your dose or only supplementing during low sun months is reasonable. In clinical practice, we usually consider blood levels of 25 on hydroxyvitamin D between 50 and 70 on as the safe and ideal range. Once you're in that zone, switch to a maintenance dose around 1,000 IU daily or every other day. Vitamin D3 is a powerful tool for bone health, immunity, and heart function. But like any hormone in your body, it needs regulation, not overuse. That's the key to getting real benefits while avoiding unnecessary risks. So you see, vitamin D3 is far more powerful than most people realize, and that's why it needs careful management. But when we talk about the trio D3K2 and magnesium, there's one component that's completely different. It doesn't stay in the body long, it doesn't act like a hormone, But if you're lacking it, your body will let you know fast. That's magnesium. If vitamin D3 is a hormone that needs careful regulation, magnesium is a whole other story. In my 30 years working with patients over 50, I've rarely met anyone who truly had enough magnesium without supplementation. And the reason is simple: magnesium is a mineral that gets depleted daily, not stored long-term in the body. Every stressful day, every meal high in refined carbs, every workout, and especially as we age, magnesium quietly gets drained. That's why research shows over half of adults are chronically deficient, often without realizing it. The body usually signals this with everyday signs: trouble sleeping, nighttime cramps, a racing heart, or unexplained anxiety. But here's the critical point. I always emphasize not all magnesium is created equal. Some cheap forms barely absorb and just upset your stomach. Some work short-term for constipation, but cause digestive issues if used long-term. In my practice, I usually recommend magnesium bound to amino acids, especially magnesium glycinate, because it's gentle on the stomach, well absorbed, and clearly supports both sleep and the nervous system. Unlike vitamin D3, magnesium doesn't need cycling if taken at a safe dose around 300-400 milliliters per day. Any excess is naturally excreted in the urine. When supplemented correctly, magnesium isn't just a supportive mineral, it becomes the foundation that helps your body stay calm, balanced, and recover well after 50. Magnesium helps your body relax, keeps your nervous system in rhythm, and lays the foundation for calcium to be used properly. But even if you're getting enough magnesium and vitamin D3, there's still a crucial question: where is the calcium going? And the answer lies in a small, often overlooked nutrient that plays a decisive role: vitamin K2. I often describe vitamin K2, especially the MK7 form, as your body's traffic cop. It stands at key intersections, directing calcium into your bones and teeth where you truly need it, while preventing it from settling in dangerous places like your arteries, kidneys, or joints. When K2 is lacking, calcium can take the wrong path, and over time this contributes to problems like vascular calcification or kidney stones, issues I see frequently in patients over 50. A little known fact is that vitamin K2 has a relatively short half-life. That means your body doesn't store it for long. So if you're supplementing with vitamin D3, taking K2 consistently every day is a smart cardiovascular protection strategy. In most cases, K2 is safe and well tolerated. There's only one important exception: if you're taking blood-thinning medications like warfarin, you must consult your doctor before adding K2. For everyone else, K2 is the quiet but essential piece of the puzzle that ensures calcium truly works for your health rather than becoming a hidden risk. In medicine, there's a simple rule I've learned directly from my patients. The body always works as a system, not as separate, disconnected parts. When it comes to vitamin D3, K2, and magnesium, I often describe it as a three-legged stool. Remove just one leg, and the whole balance starts to wobble. Vitamin D3's job is to carry calcium from your diet into the bloodstream. But stopping there doesn't complete the story. Vitamin K2 acts as the coordinator, directing calcium into the bones and teeth rather than letting it wander into arteries or kidneys. Magnesium, though less talked about, is the quiet backbone. It activates vitamin D into its usable form, keeps your heart rhythm steady, and provides a structural framework for your bones to actually hold on to calcium. I've seen many people take high doses of vitamin D, hoping to protect their bones, but skip magnesium entirely. In that case, the body has to drain its magnesium reserves to process D3. The result? Very familiar signs: nighttime cramps, headaches, lingering fatigue, even an irregular heartbeat that seems to appear out of nowhere. So my honest advice is this: don't take just one on its own. Take all three together, or make sure your daily diet gives you enough of all three nutrients. When all three legs are strong, your body can truly stay steady and balanced after 50. Remember one patient, let's call her Mary, 62. She came to me with persistent night cramps and a skipping heartbeat when lying down. She was doing everything right according to online advice, taking 5,000 IU of vitamin D3 daily for nearly 2 years to protect her bones. But when I asked about magnesium and K2, she shook her head. She had never taken them. Her labs showed vitamin D levels were high, magnesium was low, and there were early signs of calcium starting to deposit in her blood vessels. When we reduced her D3 dose, added magnesium glycinate at night, and included K2 MK7, within weeks, the cramps nearly disappeared. Her sleep improved, and her heart rhythm stabilized. Mary's story taught me this. It's not about lacking knowledge, it's about coordinating the right nutrients together. Especially after 50, balance always matters more than just taking a high dose. I always tell my patients the body rarely just crashes out of nowhere. Before serious problems appear, it usually sends very subtle, gentle signals. The question is, are we paying attention? When it comes to supplementing vitamin D3, K2, and magnesium, these overload signals are even easier to miss. One of the earliest signs is brain fog, difficulty concentrating, even when you're eating well and sleeping normally. Many people shrug it off as just aging, but in reality, it's often a sign that your mineral balance is off. Next are mild digestive issues, bloating, nausea, or occasional loose stools. They're not dangerous, but they're a clear hint that your digestive system is being asked to process too much at once. I also see quite a few people reporting a flat mood, lack of energy, or unexplained anxiety. And finally, the classic warning, muscle tension or nighttime cramps. This is your body's way of saying the ratio of D3, K2, and magnesium is out of sync. When these signs appear, my advice isn't to panic. It's time to scale back, adjust your doses, and give your body space to rebalance. After 50, listening to your body isn't just wise, it's one of the smartest forms of self-care you can practice. Before we wrap up, I want to leave you with a very simple message. Supplements are not inherently bad. They've helped countless people over 50 live healthier, more flexible lives and feel confident in their bodies. But like any powerful tool, if used incorrectly, their benefits can turn into a burden. Think of supplementing as a long-term investment in your health. A smart investor never pours money in blindly. They know when to increase, when to maintain, and just as importantly, when to pause and observe. Your body works the same way. It needs attention, careful listening, and timely adjustments, not high doses taken blindly over months and years. If you're also taking calcium omega-3 or any other supplements, I invite you to leave a comment below. Share what you take and when during the day. I'll do my best to read and respond, helping you organize your schedule to avoid unnecessary interactions, prevent wasted money, and most importantly, keep your body safe. And if you found this helpful, don't forget to subscribe to the channel and hit the notification bell. I'll continue to guide you on your journey towards sustainable, healthy living after 50.